Hello and welcome to another informative episode of The Time with the Specialist Dental Edition on AAU TV. My name is Isabella Tete Ahinakwa. This program is brought to you by the Association of African Universities and is one of the segments featured on HealthAfrik. And since we started, we've been discussing oral hygiene habits, oral hygiene devices, and also how to appropriately use them. We also discussed the importance of incorporating fluoride into your oral hygiene practices. And today, we'll be discussing some of the health-related issues in dental with our resident guest. Yes. So we'll go for a quick break. When we come back, I'll introduce the topic, our guest, and also start with the discussion. Stay tuned. You're welcome back from the break. If you just tuned in, this is HealthAfrik, specifically Time with the Specialist Dental Edition. You can follow this discussion also on our social media handles at Association of African Universities on Facebook and YouTube. And today we'll be discussing one of the most widespread and also persistent health problems affecting people of all ages worldwide. That is caries, also known as tooth decay or cavities. And we'll be doing this with our own resident guest who goes by the name Dr. Nana Akonorbea Addo-Kwafo, she's going to provide us a comprehensive overview of the etiology of dental caries. Hello, Doc.
Hello.
You're welcome to the Time with the Specialist Dental Edition.
Thank you.
Good to see you again.
Good to see you too.
Right. So we are going straight to the discussion. As I said, today we are discussing dental caries. I know when we talk about dental caries, it's maybe damage on the tooth, right? So if per your perspective or by your perspective, you can elaborate on the dental caries and also how they develop in the mouth.
Okay, so dental caries is basically the loss of tooth material by the action of acids that are produced from fermentation of food by bacteria. Yeah, so basically bacteria that is naturally in our mouth feeds on the food we eat. Then the byproduct is acid, and this acid sort of dissolves or demineralizes the tooth material. Okay. This starts cavities.
Oh, okay. So what are some of the primary factors that contribute to the formation of this caries?
Okay, so there are four main factors that contribute to caries. So we have bacteria, fermentable carbohydrates, we have susceptible tooth surface, then we have time. Okay. So basically you need all of these four components for a cavity to start. Yes, so when it comes to the susceptible carbohydrates, for instance, so basically it's got to do with the foods that we take and the effect of those carbohydrates on the tooth, that is the effect it has in terms of causing caries, depends mainly on the physical form of the food, the chemical composition, and the frequency of intake. So if you take in like sugars or fermentable carbohydrates more often, you are more likely to get caries. Also, when it comes to the physical form, if the food is sticky, yes, yeah, it has more effect than foods that are cleared easily from the mouth. Then when it comes to the chemical composition, from basic school, we know that we have like different types of carbohydrates, the polysaccharides, disaccharides, monosaccharides. The polysaccharides are not easily fermented by bacteria. So basically, if you are taking in food that has glucose, sucrose, or fructose, you are more likely to get caries.
I know there are types of bacteria, if you can mention some of them, especially the one present in oral cavity and the role they play in the development of this cavity.
So when it comes to bacteria, so basically you can say that the mouth is an ecosystem of like different bacteria. We have over like 700 species. Some of them are acid producing bacteria and some of those bacteria are resistant to acid. That's how come they can survive in the oral cavity. So when it comes to dental caries, the main culprit is Streptococcus mutans. It has the ability to form biofilms. It also has the ability to resist the oral environment, and so it's able to survive. And it has the ability to ferments carbohydrates, which ends up producing acid. But in addition to this main culprit, we have like others like the Actinomyces species and the Lactobacillus species as well.
You made mention of the consumption of sugar and also some dyes. We would want you to elaborate on this, probably in the consumption of sugar in the etiology of dental caries.
Okay, so when it comes to the consumption of sugar, sugar basically serves as sustenance for bacteria. So you can say that the sugar provides bacteria with energy. Then the byproduct of that energy, when they use up the sugar for energy, is acid. Yes. So that acid is actually like the culprit of dental caries. But well, in the absence of the sugar, there's nothing for bacteria to feed on to produce the acid. And that's what makes sugar like very important when it comes to like the etiology of dental caries.
Okay. Are there any diets that also causes the caries?
Yeah, so basically any fermentable carbohydrates can cause.
Okay. All right. Aside that, I'm sure there are other risk factors that makes people susceptible to developing caries. What are some of these risk factors? I know maybe age or something.
Yeah, so you can say your oral hygiene practices. Yeah, so if your oral hygiene practice is very bad, that is, you don't brush twice daily and you don't brush every day, yeah, you can have food stain in your mouth for long, the bacteria will proliferate, and that can cause like dental caries. Aside the oral hygiene too, the fluoride exposure, and that is why usually we stress on using a fluoride toothpaste, because with fluoride, if you have more fluoride incorporated into the substance of the tooth, it becomes more resistant to acid attack. Yeah, but if you don't have fluoride being incorporated into the tooth, then the tooth can easily be attacked by acid. Yes, and also in terms of age, you can have caries in younger people, older people, and it happens in all ages. But over time, especially with older people, your teeth can wear down, your gums can recede, and that makes it more likely to be decayed than.
All right. Okay. Before we go for break, I'm sure someone will also be asking, probably maybe there are some certain population who are also at high risk of developing caries. If you can touch on that, then we go for break and then continue.
Okay, so I'll start with patients that have dry mouth. So there's a condition known as dry mouth syndrome. So with those people, production of saliva is a problem. So constantly the mouth is dry and the cleansing action of saliva, it's not present. Yeah, so they are more likely to get caries. And also we have something we call gastroesophageal reflux disease. So basically the acid in the stomach can come into the mouth because like there's a problem. So constantly, if the acid keeps coming into the mouth, it wears down the tooth, susceptible to the caries. Yeah, and also we have certain eating disorders like anorexia and bulimia. So also with that one, the person is constantly vomiting, and acid from the stomach can wear down the tooth and makes it prone to caries.
All right. Thank you very much. We'll go for a quick break. Stay tuned.
Explore a whole new world of exciting visuals with AAU TV. Get ready for a mix of interesting talk shows, interviews, discovery documentaries, and news on AAU TV. It's not just about watching TV, it's about experiencing something special. AAU TV reaches over 25 countries in Africa, bringing you a blend of knowledge and fun. Learn about different cultures as you enjoy the shows. If you have events or want to showcase your business, we've got you covered. Watch AAU TV free-to-air channel on satellite. Connect with us on Facebook, Instagram, and X, formerly known as Twitter, at AAU TV. Reach out on call or WhatsApp us at +233 26 629 6601 or +233 20 399 5210. AAU TV, the voice of higher education in Africa.
You're welcome back from the break. If you just joined, this is Time with a Specialist Dental Edition. And today we are talking or discussing the etiology for dental caries with our resident guest, Dr. Nana Akonorbea Addo-Kwafo. Hello, Doc.
Hello.
Thanks for sticking with us. Before we went for break, we were discussing some of the risk factors that contribute to the development of the cavity. Now, can you tell us some of or describe the early signs or the early symptoms of these issues?
Okay, so you can have black to brown discoloration on the tooth surface, and this is commonly seen on the chewing surface of the posterior teeth because those areas have like pits and fissures. So sometimes you notice that they have these black brown colorations. That's like a very early sign you see. Also, you can see holes or pits in your teeth that like you can actually see when you look through the mirror. Yes. Then sometimes you experience teeth sensitivity. That's depending on the stage it's gotten to. Yeah. Then there are times you have mild to sharp pain when you are eating or drinking something sweet, hot or cold. Yes. You can also have pain when you bite down. Then finally it progresses into like severe toothache.
Okay. I can see there are stages. Looking at how you are mentioning the symptoms, there are stages to this disease. Now, if you can describe or like relate it when you mention the stage, then maybe align it to the symptoms. So that if somebody is having this symptoms, you know that okay, I'm at this stage. Okay, I'm very, very at this stage.
Yeah. Okay, so I'll do that using the layers of the teeth.
Okay.
So basically we have 3 layers, which is the enamel, the dentine, and the pulp. Yeah, so when the cavity is in enamel, yes, usually that's when, for the early sign, that's when you have the discoloration. Yeah, then you can see like some pitting or some shallow holes. But at that point, you have no pain, you have no sensitivity because the enamel basically has no nerves or blood vessels. And when the cavity gets into dentine, which is the second layer, over there you have some form of nerve endings over there. So you may be experiencing sensitivity on and off, especially when you eat and food gets in. You take something cold, something sweet, something hot. And when it progresses further into the inner cavity, which is the pulp, that's where you have the nerves and the blood vessels. That's when you start having pain. Yeah, so the pain, it can be sharp, it can be throbbing. Sometimes when you bite, you have pain. Then once it gets there, it progresses to something else that we call apical periodontitis. And at that point, it's like you can't even sleep. The pain becomes very unbearable.
Now let's dive to the treatments available based on these stages. What are some of the treatment approaches for them? Okay,
so for the treatment, so basically when you see the black discoloration, usually we have a way of testing to see if it's an arrested caries or it's actively going on. So if it's arrested caries, you can just improve oral hygiene. We could do fluoride therapy and you are fine. But if there's actually some pitting, then you have to go in and fill it. So when it's within enamel and dentine, you can go ahead and do a filling. And the filling, we have like different materials that we use depending on the depth of the cavity. Yes, but once it gets into the pulp, then you have 2 options. Either you are taking the entire tooth out or you are doing something we call a root canal treatment, which is sort of like denervating the tooth such that the tooth is in your mouth but is lifeless or dead. Yeah, basically.
All right. Now, one of the focus of this program, aside we talking about the symptoms, how it develops, we also want to know the preventive measures so that we will avoid getting this disease or get the risk. We will avoid the risk factors contributing to this. So, being an expert in that field, what would you advise us as a preventive strategies to incorporate in our oral hygiene practices?
Yeah, so first and foremost, I'll talk about good oral hygiene practices. And good oral hygiene practices here means brushing twice daily with a fluoride toothpaste, as we've been singing always. Yes, and also you try and incorporate flossing into your practices so that you can get rid of plug and food particles from in between your teeth. Yes, also with the brushing technique, we talked about using the soft bristle toothbrush. Yes, to ensure that you are not getting gingival recession, because with gingival recession, when the roots of the teeth are exposed, you are more likely to get caries in those areas. Yes, and also you'd have to visit your dentist regularly, at least twice a year, every 6 months. Yeah, to make sure that if you have any cavities, it's picked up at the early stages, then a filling can be done for you before it gets to the point where you're in severe pain.
I'm interested, you mentioned incorporating fluoride. I'm interested in knowing the role it plays in the prevention of caries.
Yeah, so as I said already, it's basically acid that is demineralizing your tooth.
Yeah.
Yes, but once fluoride is incorporated into the tooth substance, it becomes stronger and more resistant. And even if demineralization has started and is in the early stages, the fluoride can remineralize the tooth to prevent further progression of the decay.
Oh, interesting. Right, and I don't know, I think we've exhausted our time, but probably maybe I left something, or maybe your last word to our audience, or someone suffering from the early stage of caries or cavity. What would be your last words to these people?
Yeah, so my advice is, if you've noticed any of the signs and symptoms that we talked about, you try and go to the nearest dental clinic and get it checked. There are a whole lot of things that people do at home, but when it progresses from just caries to pain, there are a lot of things that can happen, and it can actually get life-threatening. So if you have any of these symptoms, just see a dentist and they'll take it up from there.
Right. Thank you, Doc, for joining us, and hope to see you again in our next episode. And that is all for this episode. If you just joined today, we were discussing the etiology for dental caries with our resident guest, Dr. Nana Akonorbea Addo-Kwafo. And you can follow our social media handles at Association of African Universities on Facebook and YouTube to watch the full episode. Just like she mentioned, if you are feeling any of these symptoms, do not sit. It's about time you go see your dentist. In our next episode, we'll be discussing early childhood caries or rampant caries, and we would appreciate if you can leave your comments or questions on the section or the comment section on our Facebook and YouTube page. See you again in our next episode. My name is Isabella Teta Henakwa. Bye.